Good afternoon, clinic members. I'm here with my partner, and we are speaking to you today to review the questions that we invited you to send us, review our responses to those questions, frequently asked questions about coronavirus. And we're glad to be talking to you today through the practice manager's assistance, i.e. my wife. We're learning to use these new broadcast techniques. So if we fumble, give us some grace, but we'll work. Zane, would you like to say hello?
Hello, Fischer Clinic family. We miss seeing you guys, and we look forward to talking to you soon in public, hopefully, or face to face. But again, like Dr. Fischer said, we're here to try to answer some questions and just to reach out and touch base with you again.
And we're going to go through a series of questions. Our intention is to give you answers that are based in solid references and resources that we use in our medical practice. And to the extent that anything we might say departs from standard guidance that you've seen through the CDC or North Carolina Department of Health and Human Services or other reliable sources, we don't want to sow any confusion in this. If there's a differing, I suspect it's our misstating of what you might find on those sources. So we are going to list some sources that we reference often and have trust in, and we hope that we can convey our trust in those resources to you. So without further ado, we're going to go through these questions, and we'll endeavor to start sort of broad and go narrow. I'm going to briefly talk about the basic question of what is a virus. That has been sent to us, and there are conflicting things in the media about whether this virus is any different than any other virus, or and all sorts of misinformation. I will tell you briefly without long form medical school explanation, but a virus is a non-living particle that contains genetic material and that inserts itself into your cells and causes your cells to produce the virus. And viruses can enter the body through various different portals, but generally intact skin does not allow viruses to penetrate. So usually it is through what we call mucous membranes. That's your eye, your nose, the soft things that don't have hard, called keratinized skin. So those are the vulnerable points of entry. Your body starts to manufacture the virus. Your body recognizes it as foreign material, and then you start the immune process of fighting it off. So I guess one of the upshots of that basic what is a virus question is what kills it, and indeed antibacterial soaps, anything antibacterial is not going to do anything necessarily for a virus. We'll get into what kills this virus, eliminates it from surfaces. It's not real hard to quote kill, but again, I guess I should use that word in quotes because it's not really living. It's a mysterious little entity. Viruses are that can impact living tissue, but themselves don't have metabolism, don't have all the characteristics that define life per se. And our next question is just general. How do you deal with conflicting information in this information overload age? That's a big philosophical question that I'll punt to my partner.
I think we've mentioned before in our videos to limit how much media that you consume, especially in this time with so many options and not being sure what is accurate and what is correct. And so I think the first step is just limiting the information that you take in. And then the second step is using trusted sources, and the sources that we've linked are ones that we think are trusted: the CDC, the North Carolina Department of Health and Human Services, and also there's a source that we use called Up to Date, and we've given you the link to that. And then the final one is Harvard. And so anything that you might come across on the media that you have questions about, you can probably find the answer, at least what is most scientific and proven at this point, on one of those sites. to help you out. There's been a lot of knee-jerk reactions to different things and a lot of theories and possibilities, but some of those things haven't turned out to be true. And so if you'll stick to those places, I think you'll find the most up-to-date information.
Right. Thank you, Doctor. And we say link to, I think, on this broadcast, if not in other places, we will show those websites. And if you limit your sources to good, reliable sources, then that will help to deal with the anxiety of uncertainty that still exists. We cannot give complete certainty about this because it's not always known about treatment or testing and all those questions. How long it'll be here, we'll go into that in specific detail. And speaking of specific questions, guidelines for going out into the public and protecting yourself. Masks have sowed a lot of anxiety and discontent. Why were masks originally not recommended, and why are they recommended now, and what types of masks? So the current recommendation for going out into public is to wear a mask, and it can be, and it's in fact recommended to be a cloth covering, a homemade mask over the mouth and nose when you're out into a place where social distancing is difficult, meaning that you can't maintain those 6 feet of distance, and that's typically the grocery store or the pharmacy or another location like that. So why was that not initially recommended? I don't know exactly, but I would surmise that mainly because it was not possible initially, or would have likely caused an increased demand for masks that could not be met at that time. Now there's, with home production of masks and other means, it is feasible for all people going out in public to do that. There may have been, and there remains, some uncertainty about how much that protects you. What we believe to be true is that a mask is great protection from a person who is sick for the people around them. So in other words, if the sick person is wearing a mask, that will significantly reduce the amount of droplets that are sprayed out from that person when they cough or sneeze. And so protecting the people around you. So wearing a mask is more of a service to the people around you than it is for yourself. But it does also seem to be a good reminder to us to not do the thing that we're repeatedly told, which is don't touch your face. And that's always been true in flu season and any other time where viruses are circulating a lot. Many respiratory viruses get their access into our body when we rub our eyes or our nose, and therefore inoculate the virus. Zane, would you like to say something about gloves?
Yeah, sure. So again, a lot of information about people to or not to wear gloves. The CDC actually does not mention it on their website in regards to the coronavirus. And one of the big things that's happened is people are riding down the street after wearing their gloves and throwing them into the street. And so, if someone has been infected and those gloves are there to, just to be a mess. And so, on that standpoint, if you're going to wear gloves, don't throw them out the window. But so again, there's no concrete recommendations from the CDC on wearing gloves. The main thing is hand washing and not touch your face. If you feel like you want to wear gloves, there's no downside to it other than just more trash. But I think, again, just wash your hands. If you go out in public, go to the grocery store, and wash your hands. After you touch your cart, disinfect the handle to your cart. Again, don't touch your face as best you can. As you go to the grocery store, just trying to maintain that 6 feet distance, if possible. And again, when you get out of the car, wash your hands or sanitize. After you finished in the grocery store, when you get back in your car, sanitize. When you get home and take your food out, after you've done that, sanitize. The CDC does not necessarily mention anything about wiping down your packages or your food when you get home. And so, I think some people they want just an extra level of security, and you can do that, but the spread through packages and and through takeout food is not likely to be a big deal. And so the bigger thing is washing your hands and not touching your face.
Yeah, Zane, we were talking before the broadcast about spread through the gastrointestinal tract, and that does not seem to be a significant means. You want to mention that?
That's right. Yep. So this virus is not a very strong virus, in the meaning that it's easy to kill. And so we'll talk later about disinfectants, but your stomach acid kills this, at least appears to kill this virus very easily. And so it's more of an issue of through your eyes, through your nose, and those means of transmission as opposed to GI tract. So it seems like, at least for now, that takeout food is relatively safe. Your groceries, treat your groceries like you do normally to prevent foodborne illnesses. Chill them when they're supposed to be chilled, cook them thoroughly when they're supposed to be cooked, and just handle food in a normal, safe way. And that should be fine. Again, if you're going to touch your packages and you're concerned about that, just after you touch your packages, wash your hands. And the same thing for UPS packages or Amazon packages. There is news about it living on surfaces of cardboard and different things for a prolonged amount of time. But again, that's not thought to be a very prevalent source of transmission of the disease. So again, just keep your hands washed and not touch your face.
Right. So let's talk with the questions about wiping down surfaces and how to clean your home and all those sorts of things. These, again, I would commend to you the CDC site has good detailed instructions about what cleaners work. There are a fairly encyclopedic listing of them, but it turns out that most simple cleaners, household cleaners, are effective to kill this virus on surfaces. So specifically, any kind of a bleach, even a dilute bleach solution will do it. Soap and water, just like it takes it off your hands, will take it off surfaces. And anything with 70% alcohol or greater is effective. So those are the things you want to use to wipe down, and the surfaces that you want to wipe down are the surfaces that are most likely to have received hand contact, but principally, but if a room has been occupied by a person who is sick and has been coughing and sneezing and those sorts of things, it's going to take a more deep cleaning, and any surface you would want to clean with one of those solutions. The washing of clothes for most of us is not a big problem if you've been in a place where you're saturated. If you're working in an emergency room and you've been around the virus all day, then clearly people in that situation are wanting to remove their clothes carefully, not shake them out. There does seem to be a possibility if you shake your clothes before they wash, that may cause some problem. But again, that's mostly in situations where really that your clothing is saturated with the virus.
Also been recently a report of or a question of whether it spread on the bottom of shoes. And again, I think if you were working in the ER all day long, then you probably want to leave your shoes outside when you got home or disinfect them. Probably not a big deal for the regular run-of-the-mill person. If you want to be safe and leave your shoes at the front door, I think that's a fine thing to do. But again, probably like the packages, it's probably not a big source of infection and transmission.
Lots of people have asked about vitamins or supplements for prevention of this illness. What are your thoughts about that?
So there's no proven vitamin supplements to necessarily say to take to prevent this illness or to decrease the likelihood of it becoming severe. Dr. Fischer and I are both fans of a healthy diet with lots of fresh fruits and vegetables, trying to avoid too much sugar, too much alcohol, too much processed food, and that sort of thing. And so if you're doing that, I really don't think you need to take anything. If you don't feel like you're getting a sufficient amount of those kinds of foods, then regular multivitamin could be helpful. And neither one of us take anything on a regular basis. So do you have any other thoughts on that?
No, I agree. We sing the same tune there, and you know, I've had this question from patients, and have generally said what I always say, which is my observation of patients over the years, that what separates the healthy from the less healthy is not how many vitamins and supplements they're taking. You know, no aspersions on those things. They may be helpful in some instances for some people, but it is those are what I would call the fine adjust knob. The big adjust knob of health is all the things that you mentioned: eating healthy, staying fit, getting your rest, paying attention to the relationships in your life, just living a whole and healthy life is more important than supplements. And in this specific illness, there are no proven preventive supplements, though lots are proffered. Vitamin C always comes up, that has been coming up for a long time for viral illnesses, and there may be something to it. There have been some high dose vitamin C treatment trials. Again, all investigational. Fine if you take vitamin C, but we're not seeing definitive evidence, and it's not our clinical experience that those are the most important things to stay healthy.
And similar with zinc. Zinc's another one that's been touted before for viral things. And again, like Dr. Fischer said, not a whole lot of at least science evidence-based proof of that. So again, just like the vitamin C, the bigger thing is healthy lifestyle and doing the things that Dr. Fischer mentioned. Stress is another thing to try to manage well. Stress increases hormone levels in the body that are counter to your immune system, and so using your mechanisms to handle stress in the best way and to dissipate that stress in the best way that you can is helpful for your immune system also.
Great. Some questions on testing, so we'll answer those. I'll start. We've had a lot of inquiries in recent days, understandably, about the antibody testing, which is much in the news. And my general counsel on that is let's wait for a high quality test before we all run out and get one. So an inaccurate or invalid result is worse than no test. And the antibody test is unlikely to change what any of us do in the next couple of weeks, right? So the antibody test will help us to know if it will tell you if you had the infection before and have formed antibodies and are, we think, presumably now immune to it. So if you think you had coronavirus and you think you might be immune, that's good. If you want confirmation of that, let's wait for a good confirmatory test. If we send you out for a test now that's of low validity and it gives you false confidence that you can go out and get it and didn't have it, now you really do have it, anyway, you can follow the logic there. I'm urging restraint and wait. It will be helpful at some point, but there's no rush on that.
No rush on that, and still not widespread available either, especially from a reputable source. With the antibody testing, and even with the testing for the ELISA test for whether or not you have the active virus or not, is still not widely available and still only recommended under circumstances of people presenting to healthcare facilities, mostly hospitals, with severe disease. The recommendations are still that if you have mild disease, to stay at home and don't proceed to testing.
Yeah. Then do you know anything or want to say anything about rapid testing and any awareness about that?
Yeah, I think some of the hospitals have that availability. I don't think it's widespread available in the community, and I don't think not all the hospitals have it, and even the ones that do have it, it's on a limited basis, and they're trying to ration those to where it's absolutely needed to help manage certain situations.
And down the road, we don't know, might there be a readily available rapid test, and in a sort of next season of this illness, might it be a bit like the flu, where people are occasionally getting this at all different times, not just in one big peak illness?
Right.
Those things are possible.
Those things are possible, and as that materializes and is developed, and we can figure out how to best use those, and It still may be, if there's a high incidence of disease in the community, it still may be that there are special centers that are able to do those and have the proper protective equipment for the providers, or it may be at some point that offices like ours and regular primary care offices have those. But again, right now, that's not the case. And we will adapt and use those tests to the best for your benefit as that becomes possible.
Yes, and over the last, since we last spoke to you, we have had some experience with people having the virus and having testing, and it's really reinforced our initial thoughts about it, which is that in most cases, testing is not helpful to treat an individual patient. If you have symptoms that suggest the coronavirus, the best thing for you to do is to stay out of the public to avoid spreading it to other people. And happily, all of our patients who have had it have been able to recover at home without being hospitalized. So the optimal outcome is that. And the risk remains that if you don't likely have it and you go to a testing center, then you may well contract the virus at the testing center. And we have had, also on the testing topic, I'll mention that we have had some tests that were negative where we strongly suspect that the person actually had the illness. And some of our individual experience with that tells us that certainly there are times and places where the test is not collected properly, where the swab has not been plunged deep into the nose in the uncomfortable, unpleasant way that has to be done. Or maybe the test was done too late in the course of the illness. So I mention those things not to say, make you worried about those things, but say for people who are wondering why aren't the tests perfect, or those things. There are a lot of variations or variables in how and when the test is collected, independent of the quality of the test itself, that will affect the outcome and result of the test.
And even if a test is done perfectly, no test is 100% perfect. And so even if it's done exactly the way it's supposed to, all tests have a false positive and a false negative rate. And so again, in this illness, we've discovered that especially the patients with outpatient mild disease, it doesn't affect at all how we treat you. And even if the particular case that Dr. Fischer was speaking of that was negative, if we'd have known that ahead of time, we'd have still treated it like a positive because of the symptoms and recommended isolation and quarantine even above what the basic recommendations are now. So it really doesn't change how we're doing things.
Great. Zane, some good questions about symptoms, and we know about cough and fever. That's well popularized, but some of the more specific coronavirus symptoms that people may not know about.
Yes, like Dr. Fischer said, if you look on the CDC, they actually only list 3 symptoms of fever, cough, and shortness of breath. But there are other symptoms that have been publicized. Loss of smell is a big one, and sometimes that happens early on before you become severely sick. Sore throat, severe fatigue, aches, kind of like the flu. There has been some reports of conjunctivitis or drainage in the eye, and also some reports of diarrhea and stomach upset. There are some lesser reports of maybe some confusion, some neuropathy and paresthesias or tingling and numbness in the hands. Those are less widely reported, but those are also possible. And then, probably the vast majority of people have very, very mild symptoms, like a mild cold, or there are probably a lot of people who have no symptoms at all. And that's what makes this virus so unique to the flu and other illnesses. It's just, you don't know who may have it or who may not, and it makes it easier to spread. But again, the main symptoms are the cough, the shortness of breath, and the fever. Those are the ones to be most aware of.
Liz, can you also show the up-to-date, while we're talking about that, another reference, Dr. Lapinskes and I both use that subscription reference a lot. That's not generally available to the public, subscription for medical professionals, but they've done a nice job of creating some patient resources, and so that site will be available through this too. That's what we're looking at. What are the symptoms? Is somewhere down further on that.
And going back to those symptoms, the cough, the fever, and the shortness of breath are the ones that are most significant for worsening disease. But if you have any of those symptoms, you're already kind of isolated. But if you develop any of those symptoms, you should probably isolate yourself even to the next level until you're sure that you're healthy and don't have any other developing issues, just so that the people immediately around you aren't exposed. And if you have any questions at all about what to do or how to handle it or any symptoms, we're here. And so we want you to, as always, feel free to call us and talk to us.
Right. The next question that I have is I'll start this one. What medications are recommended? Oh no, wait a minute. Well, I'll just start on that since I was going to talk about it. What medications are available for prevention, and this specific sub question within that is what are our recommendations around hydroxychloroquine and azithromycin? Gotten a lot of inquiries about that. Some folks are interested in taking it for prevention, others for treatment when ill. We are not recommending that at this time for outpatient treatment or for prevention. There are several reasons for that. The data showing that its efficacy, that it works, is not great data, and actually some of the folks who published the original studies are coming back and saying that maybe we ought not put too much on these studies. So there's those questions. There's questions of adverse side effects, which are real. There's something, both medications have a tendency to cause an effect on the heart that when taken together that can result in arrhythmias that can be lethal. And then the most limiting is scarcity, which I know is talked about in different ways in the press, but there are widely available or not widely available. The circumstances on the ground here are that it is still not widely available, and it is a bit of a moot point because the Board of Pharmacy and the Board of Medicine in the state of North Carolina both say it is not to be prescribed for outpatient use for all the reasons that I just listed. So those are not things that we're routinely prescribing in the hospital and hospitalized patients who are severely ill. Those are being used on a case-by-case basis. And so that's a different scenario. And clearly, if you're in those circumstances, we are going to be consulting with an infectious disease specialist, and we will avail you of all treatments that are known or significantly hoped to be helpful. But before you are sick, or if you are mildly ill, those are not things that are available and that we would recommend.
As far as changes in treatments for medications for people with chronic conditions to reduce their chances of complications, the main thing with that is to keep your chronic conditions well controlled. So take your medications as we've discussed. If you've noticed that your chronic conditions aren't controlled, you should call us and we should talk about how to get those under better control. People with chronic conditions who are not controlled are probably higher risk even than people with just chronic conditions. So the more you're controlled, the better your baseline is, the better off you're going to be in the long run. And so the main thing is keeping those conditions, whether it's your asthma, your diabetes, your blood pressure, whatever it may be, keeping those conditions under the best control that we can achieve.
Then what about conditions that require use of steroids or other immune suppressing medications? Thoughts about that? So,
at this point, we wouldn't take anybody off the medication. Again, because if you do, then the underlying condition will worsen. And so it is a fine line when you're on immunosuppressant drugs, but the condition could make you at more risk than the actual medication. And so that's a very fine line to tread. But at this point, we wouldn't stop your medication. Now, if you actually got the disease, then that would be a consideration, but that would be a consideration done with probably a specialist who maybe is managing that condition, and also the medical team that was taking care of you.
We also, I know you've gotten a lot of questions about this, as people treated for blood pressure with two of the most commonly used medications, ACE inhibitors and angiotensin receptor blockers. Would you like to speak to that concern?
Yeah, so neither, I think, the World Health Organization or the CDC are recommending, or the FDA are recommending stopping those medications. And there's not at this point evidence that those medications make you more likely to have complications or more likely to get the disease.
We want people to keep the basic message is, yes, if you have a stable and controlled chronic condition, we would like to keep it stable, specifically with blood pressure. Coming off those medications and destabilizing blood pressure incurs more risk than medication added risk for COVID virus, which is a theoretical concern and not well proven in people. The access to the cell that the virus uses seems to be through a similar part of the cell that's affected by those medications, and so there may be some interplay there. But just echoing what my partner said. Let's see. And questions about managing fever. Dr. Lapinskes, we're recommending that people use Tylenol rather than non-steroidal anti-inflammatory drugs. So again, not clear that those drugs are exactly those drugs being non-steroidal anti-inflammatory drugs are that dangerous. But what are your thoughts on that?
Yeah, and that was a big point to begin with when a lot of this started. But I think the CDC and the FDA have backed off on that somewhat, and that seems to be a bigger deal for people who have the disease and have serious complications and wind up in the ICU and kidney failure and multi-organ failure. Those people tend to do worse on anti-inflammatories, but probably that would go for anybody with any illness. And so, just because there was that tendency and there is another option of Tylenol, then it's probably reasonable to favor that one. But I would say if you take the Tylenol and you're staying well hydrated and you have mild disease and the Tylenol is not working, then ibuprofen would probably be a reasonable option. The main thing is to stay well hydrated, and then if you were to get worse, then that could be reconsidered.
Agreed. Good. Let's see. Next question: how to isolate a person at home with others? So this is tricky. This is a person who's sick in the home with other people who are not sick, and the short answer is do the best you can. These things we think, except in rare circumstances, that the transmission is via droplets, and I know we've all heard a lot about that. Droplets are larger particles of fluid and mucus that travel up to 6 feet or so away from your body. And so if you're keeping the person that distance away from everybody else in the house, it should be okay. It's not going to get into under normal circumstances, it's not going to get into the air ducts and go throughout the house. So the person stays in a room with closed door, and if they need to come out of the room, if they wear a mask, don't touch anything, it's going to be okay. I have had a patient who had highly suspected to have coronavirus and lived with parents who are quite vulnerable, and I was very fearful that they would get sick, but they did not get sick. She stayed in her room and stayed separate, and so it is possible to live in the same home and not transmit the illness to others. Zane, any other thoughts on that? Is that specific enough?
I think that's specific enough. There was also questions about whether or not to treat the fever, or we talked about what to treat fever with, but the question was whether or not to treat a fever. And there's debate. Is the fever, does it serve a legitimate purpose to help fight infection? And there's probably some truth in that. And so, if you're not completely miserable, if you want to fight a fever out up to about 103, once you get to 103, then you got to start worrying about other complications. And so then, at least at that point, we would recommend treating the fever. Even less than that, if you're just absolutely miserable or you just want to take something because you don't feel well, I think that's fine too. But theoretically, the fever could help fight off the virus. You agree with that?
Yeah, I agree with that. I would say that, the people I've had who had the virus, the fatigue and muscle aches are pretty significant symptoms, even sometimes independent of the fever. But those body aches can really get uncomfortable when you have a fever, and I wouldn't hold to any particular. Don't hold that line real rigidly, just like Dr. Lapinskes said. If you're miserable, take it, and then in the aftermath of the illness, if you've had it and you have these persistent, prolonged aches and pains, but you're otherwise well, it's fine to take the medication at that point.
Also, a question about what to take for the cough, and we don't know of anything that's particular or special to take for the cough caused by this virus, and so at this point, we've not heard anything different, and so we would just recommend regular cough medications that you get over the counter, or even some home remedies that you may come up with, or honey and lemon, or Robitussin, or just the regular medications and treatments.
Great. That segues into how do you know? We hear over and over again, well, stay at home until you're too sick to stay at home. How do you know when you're too sick to stay home? The short answer to that is please call us. We're not omniscient over the telephone, but we can give you guidance and help you through that. And mostly it's shortness of breath. That's what is making us concerned and starting to worry. And some of the patients I've had who had high risk instances where I have wanted people to be tested if I had a high risk patient who had chronic conditions that made him at high risk for a person at high risk for getting sick and was feeling short of breath. That was an instance where I said, I think I made a call on behalf of the person, got them a testing appointment, and at the testing appointment, they check an oxygen saturation, which helps. In that case, it's helpful to have a normal oxygen saturation test. That's a person. So anyway, those kind of instances, but we'll walk you through it on a case by case basis. Is the answer of how do you know when to go to the hospital? You call us. Zane, any thoughts about that?
No, that definitely, I agree with that. Just if there's any questions, call us.
There were going down a little bit possible after effects of the virus, even if you do survive it. Then you and I were talking. I think we're learning that as we go. I have seen patients who have quite a prolonged fatigue spell, much like we often see for people after the flu or mono, that type of thing. But my personal experience is limited, and even our collective national experience is limited with after effects. And then some questions that we don't have a good answer for, so I'll ask my partner to answer them. What is this thing about recovered patients, and why are there so few of them, and what defines a recovered patient?
Yeah, and I had difficulty trying to find an exact answer to that, and the numbers in general are hard to interpret. I think mostly the numbers that you're seeing of infected patients are probably ones who have been the sickest of the sickest and presented to the hospital. There is some community testing, but the large majority of those are probably ones that have been in the hospital. And so that makes the death rate seem higher than it actually is. Not to minimize the severity of this disease at all, but there are probably many, maybe at least 10 times more, if not more, people who have had the disease and not been tested than have been tested and found to have the disease. And so I'm not sure what the recovered patients means when you see that on the news. and how they're testing that and who they're defining as being recovered. In terms of coming off of strict isolation, the recommendations are 10 days or 7 days after the onset of your first symptoms, plus 3 days of being without fever, without any medication to lower your fever, plus your symptoms are improving, then you can come off strict isolation. And so, and places where testing is widely available and you tested positive, sometimes they're offering a series of tests to also confirm maybe a quicker return to work for healthcare providers. But for the general average person, the test is 7 days after onset of symptoms, 3 days without fever, and then your other symptoms are improving also as recovered. But again, I don't know what the definition, couldn't find the definition of what those reported numbers are of recovered patients.
Those statistics are as mysterious to us as they are to specifically the recovered patients. And statistics, a word on that. Statistics, particularly the statistic that we all kind of want to know, which is what percentage of people who get this virus will get really sick, and therefore how worried should we be about the virus? I think that's the denominator question we're all wondering, and the antibody test will eventually give us. I think it's if we are trying to grapple with the question: is this a bad illness? I don't think we need to know the denominator to know that it's a bad illness. The numerator, the number of people who are getting sick and dying, is significant, and in some communities is really significant. So I think it is something that is worth taking seriously, and I think we should all give our leaders and each other grace and recognizing that it is. I think it's an invented boogie. It's a real boogeyman. It's real scary, and figuring out how to deal with it is we're all figuring it out together. But I think that's enough said about that. The numbers the numbers matter, but it is a serious illness that has made many people seriously ill, and we have known people in our small community who are otherwise healthy who have gotten quite ill and happily have survived. But it's Zane, any further thoughts along those lines?
No, I agree with that 100%. You may look at the numbers and say, well, this isn't as big a deal as they're making it out to be, or you may look at it and say it's the end of the world. But the bottom line is this is a different disease than most flus, again, because people are spreading it without knowing they're sick, and so it's harder to isolate and stop the spread of it. It's all coming like one big tidal wave, and so even if the percentages of severe illness are low, if it all comes at one time and hits everybody, that goes to a big numerator, like Dr. Fischer said, and that's a lot of people to get sick at one time, and a lot of lives that are be affected. And so, there are a lot of people who are at risk, that are higher risk, whether because of chronic conditions or age. But again, like Dr. Fischer said, a close colleague of ours who's younger than us and in good shape recently was hospitalized and had no risk factors, and was hospitalized for over a week and thankfully recovered. But it's a serious illness, and we want you all to take it seriously and kind of think about the things that we've talked about today to try to do your best to keep yourself safe.
I think that's a run through the questions that I know we have. Zane, any closing thoughts or any questions that we haven't addressed?
I think that's it. If you have questions that you didn't have answered, feel free to email us, text us, or give us a call even.
Agreed. All right. Sorry. I want to get the last word. No, I'm not trying to get the last word. I will say I want to remind you all that although you may not recognize the background, I'm in the office. I live closest to the office, so I get to be the one who is isolated here. Dr. Lapinskes is isolated in his home, but both of us come to the office or have gone to people's homes or have done what we need to do to see people in person. And our main charge, our part of this fight is to really try to keep people out of the emergency room and out of urgent cares whenever possible, such that our patients are not in those high risk areas, and so that the ERs can take care of what they need to take care of, and so we do our part. In recent days, I've personally seen some things that I might normally have said, oh boy, I think that needs to go to the ER, and so shown up some scarier things than I normally would have, or done some stretched a little bit, but in a safe way with. I hope prudence that it all turned out okay, but those type of things, the bottom line is we want you to call if you're sick or have a problem, and if we can possibly take care of it, we will, including and always seeing you when we need to. We're even though you see us in funny locations on this image, we're here to help you and want to help you when you need us. Did I get the last word, Doctor?
I'm gonna let you have the last word.
Okay, it's my birthday. That's the very last word. All right.
Thank you, Fischer Clinic. We appreciate each one of you and count it a privilege to be able to serve as your physicians.